This is Dr. Ron Krueger from Krueger Sleep and Sinus Clinic, and I'm here to talk to you today about decreased sense of smell and taste following COVID-19 infections. This has become a increasing phenomena given the number of COVID-19 cases that we're seeing. Most everybody is now familiar that is one of the cardinal symptoms of COVID-19 is the decreased sense of smell and taste. It doesn't occur in all patients, but it does occur in a majority. Most patients will have a rapid recovery, but there are those who do not have a recovery either in the short term or potentially in the long term. Today we'll talk about some of the methods that people can use to try and accelerate or assist in this recovery. The first thing to mention is safety. Without a sense of smell, you are at higher risk for the things that we normally are aware of. Smoke and gas leak being the two most common ones. So make sure your smoke detector is functional. This is a good time to update batteries, test its function, make sure if your sense of smell can't detect it, at least a device can. The other thing is if you have gas in your house as your source for heating, make sure you have some kind of detector for that or another person in the house with you that could smell it, just to prevent personal harm. Beyond that, if you want to help the process, what we do in our patients with decreased sense of smell or anosmia is we typically recommend use of essential oils for olfactory retraining. So a simple kit like this comes with 6 oils. You really need about 4 of them over a spectrum. They are highly concentrated. You can actually, with good sense of smell, you can smell them without even opening the bottle. You can go through this with a family member or friend to test and see how decreased your sense of smell is compared to somebody who does not have a problem. That will help you establish baseline. From there, you can pick out 4 of these and do stimulation with it 5 minutes a day, twice a day. And so all you do is open, smell, try and recall memory, look at what the flavor is, see if you can get any trigger for that, and continue to work on that. It can take up to 3 months for that to work. The other options that bear some consideration, the use of nasal steroids, not a lot of literature supports it. It has been used commonly, but there are some risks. That's something you would want to talk to your physician about. There are also other options using intranasal vitamin A as a means to stimulate the olfactory fibers, and also sodium citrate can also be used as a nasal spray to reduce inflammation, drop free radicals, and hopefully promote recovery as well. I hope this video has been informational. If there's going to be resources down below, for example, our olfactory retraining sheet, and if we can be any of assistance at our office, don't hesitate to contact us. Our website is drkrueger.com. and our phone number is 425-347-9999, and we do video consults as well.